Nurses are absolutely key to a practice setting up an OA clinic. In my opinion, we couldn't be without you guys. I totally rely on my nursing team. They are my colleagues. We work as a team to ensure that our caregivers get a tailored, holistic, multimodal plan. Now, don't get me wrong, it is pretty terrifying to set up a clinic. However, we are here to help you. We have created a fantastic little resource for you. How to set up an OA nurse clinic. In here are loads of little tips and hints and empowerment pieces to ensure you guys are going to be an awesome success. Osteoarthritis requires a multimodal approach, and part of that approach involves what we call lifestyle medicine. That means looking at their weight, looking at their exercise, looking at their activities and modifying them to suit their physical and psychological state. This is an area that often gets neglected in clinical practice. We just don't have time. As vets, we are rushing from consult to consult. That's where nurse clinics are just so important. You guys, you nurses, you phenomenal beings have the opportunity to grab and run with this. So let's talk what you can do in these nurse clinics. Osteoarthritis management in our cats and dogs requires a multimodal approach, and part of that multimodal approach is lifestyle, looking at what they do and hopefully modifying it to suit their condition. Yes, we need to manage with pharmaceuticals, with supplements, maybe surgery, maybe intra-articular, maybe physiotherapy, but lifestyle is so important. And let me just explain. If we've got a cat that is really obese and they've got painful joints, we're not going to get good pain control with drugs alone. If we've got a dog that has got really arthritic elbows and that caregiver continues to throw that ball, causing them to stop, break and turn and twist through those elbows, we're not going to get control. If we've got a dog that is at home and they've got osteoarthritis in multiple joints, and they've had it for a period of time, so much so that their back hurts and their neck hurts, trying to navigate across that extensive slippery floor is going to be hugely stressful, and it could lead to acute flares. So lifestyle has a huge role to play in chronic pain management, and that's where nurse clinics are just going to excel. This is where you guys can use your skills, your knowledge, your talent as communicators to really engage our clients to create a tailored multimodal plan suitable to their life and to their pet. Nurses have actually been found to be better at detecting pain for numerous reasons, one of which is you're more likely to listen. You're more likely to give that caregiver the opportunity to tell their story. So let's harness this in these clinics. Let's know that you guys are great at listening, you've got great knowledge, you've got great skills, and you've got great empathy, which I know is a really important component of being a fantastic communicator with clients when dealing with chronic pain. You guys are absolutely key to our practices offering tailored, holistic, empathetic care plans to our clients. So imagine this is what we all want, isn't it? We want our companion animals, our pets, to leave the clinic having greater pain control so that they can continue to enjoy the activities of daily living. They can enjoy life and they can live longer. Imagine your caregivers going away feeling confident, feeling comfortable with the plan, feeling empowered about the plan. They're going to be the first to detect when things are going well, so we might be able to modify the care plan, reduce some of the interventions. They're going to be also the first to identify when things are not going well, so they can increase the care plan. They can come back and have a reassessment so that we can make sure we stay on top of the pain associated with osteoarthritis. Imagine this, imagine the team that surrounds you feeling confident that the practice offers that pinnacle care. Imagine your colleagues in practice feeling secure that the team approach that they've put in place offers the clients that they serve that multimodal, tailored, holistic care, but also that you all got each other's back and you're all sharing the load, because chronic pain is not easy to manage. And finally, imagine your practice being recognised around the town, around the local area, as offering that ultimate care. And finally, imagine your practice being recognised for an incredible service that they're providing to their clients. Imagine your clients being in the park saying, oh, you need to go to my vet because that vet-nurse combination, I really feel that my dog's condition is being managed excellently. These are the sort of things that you can achieve with really well-run nurse clinics, and I've got the faith that you guys can pull this off. And it doesn't stop there. Why just OA? Why not more clinics? Osteoarthritis, diabetes, kidney disease. There are many opportunities for you guys, these amazing nurses, to run these clinics that sit alongside us, the vets, supporting each other so that we can give the clients what they need. An absolute first-class service.